Dr. Mary Teitelbaum.
Thank you. I'm so happy to be here. I haven't been in Fairfield for 22 years, or my chiropractic college, so this is my little journey going back, bringing my daughter Carly to see everything. I'm going to leave off, or begin where Billy left off. What really happened, when I sat with Dr. Mishra, luckily, for 15 years, in the early years he sat with me and I say to him, what can we do for fibromyalgia? There's no protocols for that. What can we do for autism? The ancient doctors in their books didn't describe what to do with someone who took birth control pills and now has breast cancer, or for little children who get 60 shots and now have autism. And he told me that the ancient doctors did, in their textbooks, say that they were leaving the chapters wide open for the newer doctors to come in and write those chapters because they couldn't foresee what was going to happen. And that's what Dr. Mishra has done. And I was lucky that in the early years we sat together. Since I was seeing so many people, he had the opportunity to see what was needed. He would come out to my practice and he'd see all the fibromyalgia cases, the Lyme disease patients, people who had taken too many antibiotics. And he'd say, we know we have herbs for India, they're a little hard to get, and it took him many years to get some of the things we have. For instance, we have an herb for asthma that's incredible. It's called Kantakari. And when you take it, within a matter of weeks, most of our patients don't need their inhalers anymore. But it was so hard for him to find. The 15 years I was with him, he only found this herb about 2 years ago. So we have herbs like that. Another one is called Mankand that regenerates liver cells. Very good for people that have liver damage, like cirrhosis of the liver. Very hard to find because it's on the endangered species list. So at this point, we have all the herbs now. We have over 350, 400. And the great thing about Vijay is that he keeps coming out with more and more and more. It's just never ending. And I asked his permission at the end of the lecture. I'm going to tell you his latest project, what I don't think anyone knows about. But each project he comes out with, it's greater than the one before. And I don't know how he can get greater than this project. So I told you that now so you don't leave if you get bored. But so let's roll up our sleeves. Where's Dawn? You ready to go? What we're going to do, I'm going to show you the new chapters in Ayurveda that Dr. Mishra has written. We're going to take you from preconception into old age, and we're going to showcase some of the work that we do. Although we treat everything that walks in the door at this point, I'm going to show you some of the more common things that we see in the 3 age groups, the Kapha age group, the PITTA age group, and the VATA age group. So let's begin. Okay. So there's 3 focal points for optimum health. Address imbalances. Something we don't really think about in our culture, but you have to do that. If something goes out of balance, you want to fix it and nip it in the bud and don't let it blossom into a disease. In America, it works the opposite. Doctors keep testing you. You're pre-diabetic, and then one day you have diabetes, and then they start giving you something to cover up that symptom. But in Ayurveda, we want to address it early on before it has that chance to blossom. The ancient doctors said if you just give herbs and you don't teach the patients how to eat and follow a good daily routine, then you're not a good doctor, because the herbs can only do so much. So that's important. We also have to teach you how to detox in the correct way. In the classes that Billy was talking about, I have an hour-long lecture on detox. We don't recommend colonics, fasting, those foot baths you hear about. We definitely don't recommend milk thistle, and you'll hear why in my class. So we can go to the next one. We're going to go quickly because I have so much information to cover. Now, meditation is the key. Meditation raises consciousness to keep the patient healthy their whole life, mentally, physically, and spiritually. Patients who meditate follow the guidelines readily. Through the years, you see patterns. I've been in practice 25 years now. The patients that come in that aren't meditating, I'll tell them they have to change their diet, and they have so many reasons why they can't do that. But the patients that meditate say, I can do that, yeah, I can eat less of this and more of that. So meditation is an important thing for your overall health. Everything in the body, all the cells, organs, and glands vibrate, and meditation gives a healthy vibration to the whole system. So if you're meditating whatever ailment you have, it's easier to overcome because the cells are so intelligent. These are the 3 golden rules. Don't be tempted to go for the quick fix. This is what we do in America. This prevents you from addressing the underlying imbalance. If you have allergies and you're taking a nasal spray, you're going to continue to have allergies your whole life. I can guarantee it's not fixing the reason why you have the allergies. So don't go for that quick fix. Even the inhalers, they can give you asthma. Lots of medicines that we see, like Advair, can give you the thing they're trying to cure. So it could take away the symptom now, but it's not healing anything. That's why I love Kantakari. It can also bronchodilate, like Advair, but it heals the lungs so that in time you don't even need the Kantakari. Only address the quick fix if the situation is too painful or life-threatening. So it's good we have these pharmaceuticals, but they're a little dangerous. We want to just avoid them for a crisis. Last summer, I presented this PowerPoint at Dr. Mishra's seminar that he gave, and Dr. Hari Sharma was up before me, and he's great. And he said, inflammation is at the root of everything. It's at the root of cancer, it's at the root of everything. Then I got up after him and I said, but where does it come from? Everyone always says inflammation, inflammation. You hear about it, this drug's for inflammation, this herb's for inflammation. But if you don't address the root cause, then it's hard to fix the inflammation. Part of it comes from the diet. You're eating a lot of onions, garlic, vinegar, hot spices. Also, the lack of friendly bacteria in the gut. This is a big thing that we do to regenerate the friendly bacteria. From the mouth on down to the rectum, that long channel that carries food, there's little, what Dr. Mishra's father used to call little yoginis in that tract. These are the foundation of your health, and once they're missing, you'll get overgrowth of all kinds of infections that you might hear about. Candida albicans yeast, you could get H. pylori in the stomach. We don't want to focus on the infections. Patients come in all the time saying, what can I take for yeast? What can I take for H. pylori? That's the approach we have here in the West. What you want to do is put the friendly bacteria back in the gut. So when the friendly bacteria dies off, you get what we call dysbiosis or infection in the gut, and then inflammation starts from there. And the other source of inflammation comes from the liver. The ancient doctors said that we have in our body, our capability of digesting food is called a digestive fire, they called it. But they said that the stomach had 1 flame, but the liver has 5 flames, because it's a big organ, and there's a great tendency for it to overheat. So there's so many things that can overheat the liver, like skipping and delaying meals, anger, taking too many nutraceuticals. At least 3/4 of my practice on the first visit when the patients come in, they tell me the different vitamins they're taking, and B complex, vitamin C, zinc, all these things. But in America, we're not concerned of what we swallow. Once we swallow it, it has to go through the liver. And what's happening, people are taking so many things, it's overheating the liver, and then it backfires on you. The liver becomes very angry, and it's a big source of inflammation. So the first thing I do with my patients is to get them off those nutraceuticals. These vitamins in food were discovered in food, but when we make them in a lab and isolate them like that, they suddenly become like the toxic version of the real thing and create a lot of disturbance in the liver. So another thing is the patients come in lately with all these very fancy sounding diseases that they might have, and everything's abbreviated. My son has ADHD, or this one has SIBO, small intestinal bacterial overgrowth, very fancy names. And I always say to them, did you ask your doctor why you have that? And they said, no, they just diagnosed it. But you always want to know why is it you have that thing, and then from there you can work on fixing it. The other thing is keep the flow of prana balanced. I have an hour-long lecture that you can listen to that Billy has, where you can hear about the flow of prana, how it enters at the top of the head, where it flows in the body. I'm not going to spend a lot of time on that right now because that topic alone could take us an hour. So we could go to the next slide. So for preconception, the ancient doctor said if you want to conceive a baby, conceive it during the Brahma Muhurta. Do you know what that is? That's the time period an hour and a half before the sun comes up. This is the most divine time of the day because the elements in nature, known as Soma, Agni, and Marut, Soma is that vibration from the moon. Agni is the vibration from the sun. And Marut is the movement of those, see? And when they come into the body, they become the three doshas. That you're familiar with. Soma becomes Kapha. Marut becomes Vata, that element of movement. And Agni becomes Pitta. When they come in the body and they're called the three doshas, the word dosha means that which is out of balance. And we all know how hard it is to keep these three balanced. But Soma, Agni, and Marut are all in balance an hour and a half before the sun rises in the morning. And this is also a good time to do your meditation. I try to get up in the morning when it's still dark to meditate. My meditations are much deeper than they are later if it's the sun's up. Now, pray for a divine soul to come to the family. And don't try for conception if there's any negativity, because it's all vibration at that point. So if you ate too much and you're not feeling well, if you're very foggy or have a spacey mind, this is all from the ancient text, by the way. Pain anywhere in the body, if you're sick, angry, upset, depressed, dehydrated. Try to avoid conception if you're on pharmaceuticals. The ancient text, the ancient doctors even said, if the woman is not in the mood for lovemaking, you want to avoid that. If any seed of conflict is there, see, because that vibration will get into that soul. Okay, next one. This we're going to go quickly through. The ancient doctors gave these times. No sexual contact before the 16th day after the first day of the menstrual cycle, or you could have a miscarriage. You could shorten the lifespan of the baby. You could have a genetic defect, and it could even weaken the lifespan of the mother. They said that conceiving on the 4th, 6th, 8th, 10th, or 12th day after finishing the cycle, the menstrual cycle, day 1 of the cycle is the first day of bleeding. This will bring a boy. And conceiving on the 5th, 7th, 9th, 11th day after the last day of the cycle, the bleeding of the cycle will bring a girl. Copy this down fast. After I gave this, everyone came up to me after this whole big hour and a half lecture, and this is what they wanted to know. What were those days again? So. Now, for pregnancy, the baby and the mother can pick up each other's vibration. That's why the mothers crave certain foods that the baby is desiring. When I was pregnant with my son, I started to crave mangoes. And then when he was born, we have pictures of him in his high chair eating all these mangoes. And Dr. Mishra told me that when a mother is pregnant in India, if she has a desire for a certain food, everyone in the village gets that food for her, because you don't want that desire to be left unfulfilled, because that vibration will get into the baby. Now, the mothers can give vibration to the baby as well. So the mother shouldn't entertain negativity. Don't watch scary or sad movies while you're pregnant. Read lots of spiritual books, meditate, pray, be blissful and happy. The way you are during and after conception is the way the baby will be. Stay connected to nature. Visualize the image of who you want your child to be like, whoever your ideal is. I guess it was my father and my mother. Carly looks just like my mother, and my son is just like my father. The baby will be born with inner wisdom, will learn quickly, be healthy, and will have good physical, mental, emotional, and environmental endurance. Okay, next one. Also recommended, don't take prenatal vitamins. Again, these are the toxic version of the real thing. Don't pollute the baby like that. The reason they recommend these is because of the folic acid. If you're deficient, it could cause spina bifida. But folic acid comes from the greens. You want to cook the greens. You don't want to juice them. All the new patients coming in right now are juicing kale and spinach. You don't want to do that. The ancient doctor said every vegetable has a compound in it that's bad for you. But if you cook it, it evaporates out. So these greens have oxalic acid in them. They can leach minerals from your body. But if you cook them, then that's fine. It evaporates out. So pregnant mothers and before pregnancy should have lots of cooked greens in the diet. Avoid Accutane. This is something I'm seeing a lot in my practice. In the pulse, you can feel the 7 tissues. You know, the blood plasma, the blood, the muscle, fat, bone, bone marrow, and reproductive fluid. In Sanskrit, rasa, rakta, mamsa, meda, asti, maja, shukra. You can feel that. The Accutane, do you know what that is? It's a medicine for acne. My daughter told me lots of girls in her class are already taking it. She's only 16. So you'll see a lot of teenagers on that. What it does, that medicine can go right to the bone marrow. And now what I'm finding is when the babies are born, they have all kinds of birth defects. And when we feel their pulses, you can feel that Accutane in their bone marrow. Luckily, Dr. Mishra has Guducci, and we have a cream of it because the babies are too little to take tablets of Guducci. So we can rub the Guducci down their spine, and it'll take that chemical out of the bone marrow. There's not that many herbs that can clean the bone marrow, but Guducci is one of them. Don't do any cleansing when you're pregnant or nursing. This sounds like common sense, but I can't tell you how many patients I see. The babies are born with liver problems, and it's because the mother is cleansing the baby. She's eating all this dandelion while she's pregnant and burdock root and taking milk thistle. It's not good for the baby. Nurse the baby at least 1 year and cook the food for the baby. Don't open up those little jars of organic Earth's Best baby food. It's sitting on a shelf. It's lacking the pranic energy, the nutritional value. Just cook it and blend it and make it like that. Now, let's start with the early childhood years. This is the Kapha stage of life. During this time of life, that element in nature known as Kapha, it's earth and water, it's highest. That's why children have a lot of Kapha when they're young. They have all that mucus, and because their joints are lubricated and they're growing, Shleshika Kapha. And then they have mucus, Shleshika. Too much mucus can happen in these early years. So, friendly bacteria are trying to grow in the early years. The mother breastfeeds the baby. The friendly bacteria are starting to grow. This is a very important time because the friendly bacteria are the foundation of your health. But what happens is, on the first day of the baby's born, they give the hepatitis B shot. And from that point on, they just keep giving one more shot, and every shot will deplete the friendly bacteria. Also, antibiotics can deplete them. Then, once they're depleted, the whole immune system spirals out of control. It goes more autoimmune. It loses that intelligence and starts to go autoimmune. That's why we're seeing an epidemic of these like inflammatory bowel diseases. We'll be talking about that in a minute. So here, let's talk a little about the friendly bacteria. Dr. Mishra and I have sat for many, many years and talked about this. It's a very important issue. Now, we have in utero, before the baby's born, there's one nervous system. But once the baby's born, it develops into two. So we have the brain and spinal cord. That's one nervous system. The other is the enteric nervous system. It's found in the GI tract. Both are created out of the same type of tissue. But during the fetal development, one part turns into the central nervous system. That's the brain and the spinal cord. The other turns into the gut nervous system. The two systems are connected via the vagus nerve. It runs from the brain to the abdomen. Your gut contains 100 million neurons, more than the spinal cord. Every chemical that controls the brain is also located in the gut. Serotonin, dopamine, glutamate, GABA, and norepinephrine. 95% of the serotonin is made in the gut. Let's talk about that for a second. I see a lot of teenagers that come and they're depressed. It happens because they stay up late. We'll talk about that in a minute. So right away, they want to put them on antidepressants. What it does, it's providing the neurotransmitters for the brain. It makes things worse. This is a good example of not going for that quick fix. The kid's getting deeper and deeper because once you take the neurotransmitter, then your body's not going to want to make it. It gets lazy. See? It's like that with a lot of things. We tell the patients, don't take melatonin. Your pineal gland makes that. If you start to take that to sleep, it'll stop making it. Don't take digestive enzymes. We have a remedy that will fix your enzyme system. If you take digestive enzymes, your gut gets lazy. So here, when I see these kids or anyone who's depressed or anxious, nervous, it means the neurotransmitters are out of balance, but they're made in the gut. And I can't tell you how many times we just put the friendly bacteria back in and the kids start calming down. On the other end, I've seen mothers, they were delaying the immunizations. They were afraid because they heard these things about them. The kids are very calm coming in. They get the shots, and now they're running all around the room. They're real hyper because they're not making these neurotransmitters. This is a big, big issue. It's one you don't hear enough about. So, depleting the friendly bacteria creates all these things you're hearing about: hyperactivity, ADD, ADHD, autism, food allergies. See, the friendly bacteria keeps the immune system intelligent. The immune system knows that's a virus, I attack that. That's a bacteria, I attack that. That's gluten and dairy, I don't attack that. And that's the body, I don't attack that. That's like autoimmune. But this ability comes from the friendly bacteria. So it's missing, and then the immune system spirals out of control. So depleting the friendly bacteria can also cause thyroid problems. I have so many women that come to see me, almost every third one. They have underlying thyroid, and the doctors can't find it. The blood work's always normal. We make T4, this thyroid hormone, but it has to be converted. We can't use the T4. It's converted into T3. That's what the body can use. And that's transformation takes place with the friendly bacteria, see? Dysbiosis in the gut, again, it's creating this infection, chronic infection in the gut. It's creating systemic inflammation to the whole body. And malabsorption. The goal of eating food is when you swallow the food, it has to go from this channel, the ancient doctors called it, and break down into smaller and smaller particles so it could cross little delicate cell wall and get in your cells. And what does that? The friendly bacteria. So then, if the food doesn't break down, it gets stuck in that channel. And the ancient doctors had a word for food that gets stuck in the channel. They called it ama, partially digested food. Ama makes you feel tired, heavy, dull, lethargic, because the food's never getting in the cell where you can make the energy and feel light and blissful. It's just remaining out in the channel. Then when ama sits there, what does food do when it sits there? It ferments. And it forms something the ancient doctors called amavisha. The word visha means poison. So literally, a lot of people are actually poisoning themselves from the food because of the lack of friendly bacteria in the gut. I always tell every new patient, you're about to see what friendly bacteria can do for your health. They all come back on, I can't believe how much better I feel just putting the friendly bacteria back in. Okay, we could go to the next. Let's talk a minute about vaccines. There's a big controversy whether or not they create autism. With Dr. Mishra and myself and other practitioners who know how to do the type of testing we do, pulse diagnosis, there's no controversy. I called Dr. Mishra out to my practice about 10 years ago, and I said, we have an epidemic of autism here. 1 in 45 kids now, we're going to talk about that in a minute, have autism. You know, what can we do? He felt their pulses. He said, oh my God. He said, the amount of toxins they have in the brain at this little age, 2 years, is the amount a 70-year-old person would have who works on a farm and spraying pesticides all day. And they're getting that. And we'll talk about the shots, what they're showing. Now, the FDA says that we're allowed to have about 2 parts per billion drinking water of, say, mercury or a heavy metal like aluminum. If it becomes too, they're very worried when women are pregnant that they might get a trace of mercury in tuna fish. So they tell them, be careful when you eat tuna fish, there's a trace of mercury in there. If it falls on the ground, if 200 parts per billion were to fall on the ground, a hazmat team has to come in and clean that up. The flu shot has 50,000 parts per billion, it's shown, see? And then the shots they're giving the kids, they took the mercury out, but they put aluminum in. The babies can't get rid of the aluminum until they're a year old, so, and it's a potent neurotoxin. Okay, you can go to the next. Here's the contents of the vaccines. Formaldehyde, mercury, most of them have aluminum in them, and that rate keeps skyrocketing, the rate of autism. Antifreeze, RNA, DNA from animal tissues, aborted fetal tissues, other foreign proteins in the form of live, attenuated, or dead viruses and bacteria. The list is much longer, but I'm just showing you some of the things. Now, when I first opened my practice, I was told I would see 1 case of autism in the history of my practice, because it's very rare. It's a very rare genetic disease. Now, when I wrote this, 1 in 50 children are having autism. Now it's already increased to 1 in 45. It used to be 1 in 150 in 2002, 1 in 88 in 2012. The rate of autism skyrocketed in the 1980s after the vaccine schedule went up. It used to be maybe 11 shots, and now it's 60 to 70 shots. They took the mercury out of most, but not all, like it's still in the flu shot. But the rate of autism keeps going up. Now they removed the mercury, added aluminum. They have more shots now, but not only that, the children now have to get flu shots every year, and the mothers have to get flu shots when they're pregnant with the baby. That's a guaranteed way to get autism, if you ask me. Okay, next shot. How many shots do children get? Well, we'll just say about 70, so you can see. Right now, despite there's so much research out on the vaccines, when Dr. Mishra and I would go out and lecture on autism, invariably a doctor would stand up and go, "That's never been researched," and they'd demand their money back and they'd leave. So I said to him, "Let's look at the research." I was in shock. There's so much research. The opposite's true. When you listen to my class on the vaccinations, you'll hear me go through all the different articles that are written. If you just Google what happens to the glutathione system, that's the main antioxidant system in the body, it damages it. What happens to the blood-brain barrier? Tons of research on that. The blood-brain barrier, these tightly knit endothelial cells in the brain so that toxins can't get through. As soon as you get a shot, it loosens the barrier. They go right in. We could go on and on, but I don't want to spend too much time talking about that. But there's a lot of research out now. So if someone says it's never been researched, it's because they haven't read the research. Okay, you can go to the next one. Right now they're developing about 200 more vaccines. Treatment for autism. So Dr. Mishra came out. I said, what are we going to do? Look at these kids. They have so many heavy metals, and the gut's so destroyed, the brain is so damaged. So he had to make different remedies, and we have all the formulas now. So what we do, we balance that dysbiosis in the gut, get the friendly bacteria to grow. We chelate the heavy metals out of the brain. We reorganize and heal the brain, and we nourish the brain. Dr. Mishra is doing groundbreaking work. No one has done this. Sometimes I'll get children from India that have seen Ayurvedic practitioners over there that they have autism, and I'll ask them what they're taking, and they all say they're taking Brahmi. Brahmi helps to reorganize the brain. But see, we have to go deeper. We have to fix the friendly bacteria in the gut, chelate the heavy metals out. So just taking Brahmi, which again can help the brain, isn't quite enough. Okay. For parents, you can either start the vaccines a little later, or maybe get less. We're not saying don't get any, it's up to you. Some decide not to get any. You could take philosophical or religious exemptions. But we all forget we have an immune system. Dr. Mishra told me in India, his father was highly opposed to the vaccinations. And there they were living in villages that had polio and leprosy. And he said, none of us ever got it, but we did take tulsi and amla and some of those things to keep the immune system up. And his mother always made different types of probiotic drinks, like lassi, takra, buttermilk, to keep the friendly bacteria intact. So we have all these things. Now, there's an epidemic of food allergies right now. Again, it comes from disturbance of the friendly bacteria and overheating in the liver. That combination, when the food comes in, the body will reject it. What modern medicine and holistic medicine are saying right now to avoid the food that triggers the allergy. So a lot of the patients are coming in, they say, I'm not having gluten, I feel a lot better, I'm not having dairy. And that sounds good, but then they'll come in later and go, yeah, but now I'm not having any, this food and that. And then it gets to the point where they're not having any food because they're not fixing the reason why they have the food allergy, see? So what we do, Dr. Mishra made a wonderful formula, and as far as I know, no one has made this. It's called prebiotic support drops. And what it does, it acts like fertilizer for the friendly bacteria to grow. Then we have good friendly bacteria. I looked at every company that makes the probiotics under a microscope, and every company's cultures were dead. And it's not because the companies are trying to get over on us, but these are very delicate bacteria. Just processing them will kill the culture. But I did find one company, it's called Natron, and so we use their probiotics. And then Dr. Mishra made this other formula because he kept saying to me, it's not a question of just taking a probiotic. When you've taken lots of antibiotics or lots of immunizations, not only does it destroy the friendly bacteria, but the lining of the gut where the friendly bacteria grows. And then he made this formula called Pro-Apana, which fixes the lining of the gut. Kind of like if you were planting seeds in a garden, this would be like bringing in new topsoil. So these two, the prebiotic and Pro-Apana, my receptionists know we can't keep these on the shelves. We must go through 40 bottles a week. Apana Agni Balance. This is a wonderful remedy. Again, no one's doing this. This remedy fixes the enzyme system in the gut, so you don't have to take enzymes. See? Daruharidra. This one stops histamine reactions in the gut when there's food allergies until we can fix the food allergy. Bhumi Amla. Dr. Mishra has his favorite herb. It's Skaduchi. I love it too, but this one is mine. Miracle things can happen with Bhumi Amla. What it does, it cools the heat down in the liver. I could give you so many case histories of people that had all kinds of problems, even on the skin, because the skin is showing you how the liver's doing, sores and whatnot, and all these things go away when we give the Bhumi Amla because it cools those 5 flames in the liver down to normal. The food allergies go away. Homemade yogurt or cultured coconut water. We teach the patients how to make these probiotic drinks. So when you fix the gut in this way, the food sensitivities, they just go away. It's like a miracle. And almost every other patient, or probably maybe every patient I see, has some food sensitivity now. And the patients are so happy to know that we can fix the food allergy and they can get back on the food. I even had one little boy, if he had a drop of milk hit his arm, he had to be rushed to the emergency room. And he was rushed so many times, and he had autism. And his mother told me with every round of shots, he got a little worse, until they finally lost him. He was like autistic. But he had these food allergies. And so there was one food he could eat, and that was potatoes. Dr. Mishra and I are with him. We don't recommend the nightshade vegetables, so we told him he couldn't have potatoes. When he left, he was crying the whole way home. It took me 2 years, but he can now have dairy as much as he wants. The autism's gone. He's in a private school in our area, the most difficult school to get into, and he's doing great. The mother doesn't even want to talk about autism around him anymore because he doesn't even remember he had it. I'm just showing you how well this stuff works. It's not on a few people. It's like this with everyone. Now, let's talk about the teen years, the PITTA stage of life. That element of fire and water gets really hot during these years. PITTA becomes more active. It can give acne and other skin conditions, eczema, but we tell them don't take Accutane or antibiotics. That's what all the teenagers are coming in. They're on antibiotics for 2 years. What we do, we use an alkalinizing diet, cook at home, avoid those hot things, onions, garlic, vinegar. And by the way, onions and garlic destroy the friendly bacteria in the gut. They work like an antibiotic. They have sulfur in them like an antibiotic, so we don't recommend them. And the ancient doctors didn't recommend them either. So the herbs that we use, there's an herb called Simal that we use in Ayurveda. We have a clay that they put on their face, wash it off in a lotion. We also use Mangista. It stops the reactivity of the toxins coming through the skin. Coriander. It takes the toxins away from the skin. The skin's just an organ of elimination. It's just not doing what it knows how to do. It likes to get rid of toxins. But coriander can direct them away from the skin and into the urine. Neem, that's a famous Ayurvedic herb for liver, skin. Zinc, you know what the basmas are. The ancient doctors said that the minerals like zinc and iron are too big to absorb in the cells, so you have to burn them into an ash called a basma. So we have the zinc basmas. Zinc's very good for skin conditions. And then we also have pre and probiotics for the face. I don't know if you know this, but the skin has probiotics on it too. Dr. Mishra's father, way back when, used to use these. His family's lineage always treated skin conditions. They treated Lord Krishna's son for leprosy. So the skin itself has probiotics, but if too many acid toxins are coming through the skin, it can burn the friendly bacteria, and then you can get fungal infections. So in America, the doctors treat the fungal infections with antifungal creams. What we do, we put the friendly bacteria back on the skin, see? Okay, you can go to the next one. Depression. Again, this is what a lot of the teens are coming in with, depression, anger. When the liver overheats like that, you can get angry easily. So when children are young, they usually go to bed early. They have no choice. They play outside. They eat what the mother cooks. But when they get older, they want to stay up late, stay inside, go on the computer, cell phones, video games. Then they start eating junk food, and the next thing you know, they're getting really angry because the liver is getting toxic and hot. So again, the antidepressants supply the neurotransmitters, throwing the brain more out of balance, and the brain and the gut forgets how to make its own. What we do, we reestablish the early bedtime, limit the exposure of the computers and EMFs, and then we have lots of different herbs we can use. These are a few, like Arjuna, Sadhaka Balance, Arjuna, Shoka creams down the spine, organic rose. Rose is very good for PITTA. We have calm mind drops, on and on and on. Digestive ailments. We're seeing an epidemic of teens with irritable bowel syndrome, gastroparesis, ulcerative colitis, and Crohn's disease. Okay, you can go to the next one. Let's just take a brief look at each one. Irritable bowel syndrome. So many patients come in, I have IBS. And I tell them that means nothing. It just means your bowel's irritable. But we have to see, why is that? So you have to find, in each patient, it's different. So you have to see in that patient what's causing it. We have great results in these cases. This is one of the easy things to treat. Okay. Gastroparesis, it's delayed stomach emptying. Foods aren't moving through. The most common reason is that the bile that the gallbladder is holding becomes like a sludge. See, the bile is always has two detergents in it, and it's always breaking down the fats in the food you eat so that those molecules can absorb in the cells. But then the bile can get very thick and it won't flow. And if it doesn't flow, the food won't flow through the digestive tract. So what we do, we fix the friendly bacteria. We use Triphala. The ancient doctor said everyone's going to need Triphala sooner or later, and I always wondered why that was. Then when I opened my practice, I saw everyone coming in has problems sooner or later with the gallbladder, the bile getting a little too thick. So the Triphala thins the bile and gets the movement back in the gut, and we also have the patients change their diet. Now this is very common in girls on the birth control pill, and that's because the pill is made out of cholesterol, and it concentrates the bile with too much fat, making it difficult for bile to squirt out of the gallbladder. You could go home and Google birth control pills causing gallbladder problems, and you'll see all this research. If there's an underlying thyroid problem, if the thyroid hormones are low, then the gallbladder can't empty well. I always wondered, why do people with thyroid problems gain weight? And it's because the gallbladder won't empty, fat won't absorb into the cells. Now you have this unused fat stuck in your channels, so the body dumps it into the fat tissue and makes cellulite. So when you eat fats, if your thyroid's low, the gallbladder doesn't empty well, and then the fats just make you fat, that you're not burning them as energy. Ulcerative colitis and Crohn's disease. This was predicted by Dr. Andrew Wakefield. He's the world's leading gastroenterologist from London. He published articles in the Lancet warning doctors that if they gave too many immunizations, he could see in his research that it would cause an epidemic of ulcerative colitis and Crohn's disease. No one listened to him, so they're giving the shots, and I see this over and over. I can't tell you how many teenagers I see have this. It comes from lack of breastfeeding, too many immunizations, antibiotics. We've even seen people, the new antibiotics can turn the body into autoimmune overnight. Like I had a guy come in, he was from India. He said, I came to America, I took this antibiotic called Zithromax. He says, and now I have ulcerative colitis. And that fast, with just one round of an antibiotic, it turned him into autoimmune, because these are very powerful. The treatment, regrow the friendly bacteria, bring intelligence back to the immune system. There's a wonderful herb called Boswellia. Do we have time for a little story about Boswellia, or are you getting bored? I don't know. You want to hear the story? Dr. Mishra's family lineage is very divine, and he always said how divine they were. In fact, his inspiration to make all these hundreds of formulas that he makes, not one person alone could do this, but he told me he has like a direct link to his family lineage. So when he taught me about Maha Boswellia is an anti-inflammatory, so it could be used for joint pain, and it can be used for these inflammatory bowel diseases. It works like prednisone. And I started using it, and the patients were getting better, and they were saying their joint pain was going away. And we were able to take people off prednisone and they wouldn't have a flare-up with their ulcerative colitis or Crohn's. It's hard to do. Usually they're okay on the prednisone, they come off it and they flare up again. So I put them on Boswellia and it kept them really good until we could fix the reason why they had the ulcerative colitis. So I said to Dr. Mishra, you know, I was researching Boswellia and it's known as frankincense. I said, did you know that they gave frankincense to Christ when he was born? I said, now I understand why. It's such an important herb. And he said, I said, the three wise men, I said, do you know who they are? They gave that to Christ. He said, they were my family lineage. I said, okay, I get it now. You told me your family lineage was divine. Now I see. Okay. Each of these herbs has wonderful stories. It was so wonderful sitting with Dr. Mishra for 15 years. I felt like just so blessed, I'll tell you. It's just wonderful. Okay, next one. Now, the VATA stage of life, that's where we are. So we have to watch out for osteoporosis, Parkinson's, dementia, and Alzheimer's, and high cholesterol. Other things too, but these are the big ones we see. So let's talk about osteoporosis. The bone is a living tissue. You have to remember that. It's not just a dead hunk of, bone. What you have are two types of bone cells, osteoblasts. They build up the bone. That's how I memorized it in chiropractic college. I would think osteoblast, build bone. And osteoclasts, they break down the bone. They're both made in the bone marrow. So you have this living tissue, the bone's building up, and then the old stuff breaks down. It's building up, and old stuff breaks down. Now, the osteoclasts are made from the same stem cells as the white blood cells which control inflammation. So what that means, the more inflammation you get, the more osteoclasts, the more breakdown of bone. When the body becomes more acidic, the bones give up their calcium to alkalinize the blood. And if the hormones get too low, it can weaken the bone. See, all these things can interplay. Okay, go to the next one. So I want to just show you, here we have bone resorption, the osteoclasts, bone formation, the osteoblasts, building up the bones. The bones are constantly remodeling. Okay. Now, this shows the stem cells. On the left, how they form the bone. See, you have the stem cell, and on the right, it forms bone. On the left, it forms fat tissue. Now, this is so amazing to me. The ancient doctors of India said that with each tissue, like the blood plasma, the blood, the muscle, the fat, the bone, each tissue transformed into the next, into the next, into the next. So the fat tissue, they said, transforms into the bone. And now modern science, they knew that without microscopes. They just cognized Ayurveda. See how great they were. So here it's showing you on this chart. Thank you.
There's Boswellia here.
Boswellia? I don't need Boswellia. The next one shows the stem cells making the osteoclasts. See? Now, it's one thing, let me see if I don't have a pointer, right? I can't point. Let me just go up to this. This is the normal pathway. Can you hear me? Yeah. But see, if there's inflammation, then this pathway occurs, and you make more osteoclasts. You break your bone down. Now, we can mediate. We can stop this right here with berberine-like compounds. So there is an herb that has berberine in it that can stop this pathway. Does anyone know? Some of you heard my conference last year, except for you. Does anyone know what that herb might be that can stop that pathway from happening?
Did you say berberine?
There's an herb that can stop that inflammatory. It's a berberine compound. Have you heard of berberine? It's found in some herbs. Guduchi. The reason I did this was last summer when Dr. Mishra had his seminar on Ayurveda, he had a Guduchi plant on stage. And then at night, he had these wonderful Indian dancers come in. They were beautiful. And they did a dance to Guduchi. Guduchi was his father's favorite herb. And it's Dr. Mishra's favorite herb. And I would tell my daughter, Carly, I want Guduchi to be my favorite herb, but I don't understand exactly what it does in the early years. And then as I saw what it could do, that it could clean the bone marrow, Many, many things happen. I'll tell you a quick case history that I saw. A little boy, the ancient doctor said if toxins get in the bone marrow, you'll have recurring fevers. Do you ever know a little kid that has fevers over and over? See, there's shots, they go right into the bone marrow. See, these tissues have little gaps in between. The blood plasma, the muscle, the fat, there's gaps so toxins can't get in. But these shots, they just go right down into the bone marrow. See, normally it might take several years, and then the toxins can reach the bone marrow. But with the shots, they zoom right down into the bone marrow, see? And Accutane can do that. So a woman called me for a phone consultation. Her little boy was having recurring fevers. And I said, it's the shots. They've gotten his bone marrow, and we have to get them out. But he's little. He's only like 4. And we can't give him Gaducci. Dr. Mishra, genius that he is, made these transdermal creams, like I was telling you. So I said, just put Gaducci down his spine and call me back in 2 months. So right before I came here the other day, on Tuesday, she called me. She said, he had these fevers like clockwork. He was getting them for like 2 weeks, and they would last 2 days. She said he got one more after I started using Gaducci, but it only lasted a couple hours. And then she said, now they're all gone. That stopped it. And when you hear case histories like that, and there's been others, I love Gaducci too now. It's one of my favorite herbs. It's just amazing that, let me tell you one other thing about Gaducci. You know the enlightened rishis? Did you ever hear of some of the saints, like Saint Teresa? They don't need to eat. Have you heard of that? That's because they're living off prana. The nadis in their body can suck in more prana when you're enlightened. So you don't need, prana can feed you, see, all that you need. It keeps you alive. So you ever sit in meditation after many years of meditation? Sometimes you have that feeling you don't need to breathe. It's kind of like an unusual feeling. And you start laughing because you're thinking, I don't have to breathe. It's strange. Well, a lot of these rishis in India, they have that too, where they're enlightened and they could sit in samadhi and they're not breathing. They don't need to eat. Saint Teresa ate one little communion wafer a day. Well, Gaducci is like that. It's enlightened. It doesn't need any air or soil. Dr. Mishra told me his father would just hang it in his little hut where he grew up. And with no light or soil or anything, it just grows. So this is an enlightened herb, see? Okay, so the treatment for osteoporosis. First, you have to nourish the bone. The number one nourishing food for the bone is whole milk. If you take the fat out of the milk, the fat will go in one end of the calcium will go in one end of the channel, out the other. So the fat is the vehicle to bring the calcium into the bone. Calcium supplementation won't help. If you could see the bones, they have what are called trabeculi. It's like little pieces of bone. If they're broken, taking all the calcium you want can help. Not only that, we now know, Dr. Mishra used to tell me, when I feel a person's pulse who's taking calcium, it's just stuck in the channel. And now, after he told me that, I saw research that said it gets stuck in the arteries. That's the channel he was talking about. And it can cause heart attacks. It just accumulates because the calcium can absorb out of that artery into the bone. So we have like somacal, like coral calcium. And Dr. Mishra gets the calcium from the delicate branches of the coral plant. If you get it from the base, they're not as light. So when you take coral calcium, you're not quite sure where you're going to get that calcium from, which part of the plant. Also, vitamin D, which we get from the sunlight. One of the hour lectures you'll hear me talk about is an hour-long lecture just on vitamin D and what the ancient doctors said about the sun hitting our skin without sunscreen on. If you have sunscreen, it won't happen. So sunlight, transdermally, vitamin D is toxic if you take it orally. Almost every other patient now coming in is taking vitamin D3 orally, but it's a fatty vitamin. Technically, it's not a vitamin. It's a precursor to the hormones. Helps you make your steroid hormones, see? So we get them off that, and we have them use it transdermally, but I really recommend them getting outdoors. We also see magnesium plays a big role in the bone health. But magnesium is another one of those nutrients that shouldn't be taken orally. It goes through the gastrointestinal tract too quickly. It never absorbs, and it can give diarrhea. So we have transdermal magnesium. Some people ask me about Epsom salts. They're magnesium sulfate, but magnesium chloride is the better form to use, and that's what we use, magnesium chloride. We have it in all different forms. Baths you can soak in, and putting it transdermally. We even have abhyanga oil with magnesium in it. Control inflammation coming from the liver with deglycerized licorice. It's known as DGL. Guduchi can do that, Bhumi Amla. See, because again, if there's inflammation, you're going to make a lot of osteoclasts. You have to control inflammation in the gut by regrowing the friendly bacteria. See, you're starting to get it now, right? Keep the diet alkaline. The American diet's too acidic. So again, if your diet's acidic and your body becomes acidic, your bones will give up calcium to make you more alkaline. We have the zinc basma, and you want to balance the hormones. Okay. Again, you want to nourish the fat tissue because the fat tissue makes the bone tissue. So olive oil, ghee, the fat and the whole milk delivers the calcium into the bone. Avocados, nuts and seeds, these are good forms of fats. And your daily oil massages. You know, the skin makes hormones too, out of fat. So by rubbing the skin with oil, it's a good thing, good habit to get into. Now, what modern medicine does, they give these bone-building medicines called bisphosphonates. Hormone replacement therapy was the first treatment for bone loss. But then in 2002, a study of hormone replacement therapy, they stopped the study in the middle of the study because so many women were getting breast cancer, heart disease, stroke, and blood clots. So they stopped the study. Then after that, they started using these biphosphonates. They replaced the hormone replacement therapy as treatment choice. These are things like Actonel and Fosamax, those bone medicines you hear about. What they do, they destroy the osteoclasts. So again, you have the osteoblasts building up the bone, the osteoclasts breaking down. They poison the bone marrow, they poison the osteoclasts, and now you don't have that, and you're just building up the bone. So you're creating a great disturbance. One of the things in your life, you don't want toxins to get into the bone marrow. Now you see, you get deadly diseases if they make their way there, by the way. All this cancer and autoimmune you're seeing, it's coming from toxins disturbing the bone marrow. So here you're taking a medicine that's what it does. And it creates actually brittle bones. I had an OBGYN come to me. She said that she was on these like Fosamax for about 12 years, and she just bent over and her femurs broke. And the same thing happened to her sister. So now they've done research to see, and they say that, well, after being on them 4 years, you should stop them, because that's when the bones get brittle. They also create TMJ problems, because the TMJ joint is the joint that moves the most in the body. This bone moves more than any other bone. So it creates death, like an osteonecrosis, death of the bones. And this here is like a big issue in dental, in dental care, because this TMJ is actually disintegrating, and a lot of women have committed suicide because of it. It's so painful once the jawbone starts to break down. Okay, you can go to the next. So Parkinson's. This comes from death of the dopamine-generating cells in the substantia nigra in the midbrain. But 50% of the cases result from exposure to pesticides. Other factors include any other toxin could get into the brain, like electromagnetic frequencies, that type of toxin, or lack of nourishment to the brain. One of the first cases I sat with Dr. Mishra, we had a guy fly up from Florida, and I was just watching Dr. Mishra work in the early years, and then gradually he let me take over. But someone came in, and he was 39 years old. Dr. Mishra felt his pulse, and he said, "Oh my God, what kind of a diet are you on?" And he said, "It's called macrobiotic." And he said, "What kind of a crazy diet is that?" He said, "Do you have ghee in your diet and milk?" He said, "No, there's no fat in the diet." He said, "You literally starved your brain of fat. Your brain's drying up." He said, what disease? Are you diagnosed with a disease? He said, "I have Parkinson's." He's only in his 30s. And he says, "You have to get milk back in your diet." But in our culture right now, that vegan diet is so prevalent. No animal, and sometimes the philosophy of it is so appealing to so many people. He left that day, said, "I am not going off this diet." And we never saw him again. But I'm just showing you just how lack of fats are very important. the whole brain and nervous system is made of fat, so you can't be on a low-fat diet. Did you see the Time magazine article about a month ago? Whoops, we made a mistake. Modern medicine made another mistake. That they were saying we needed to follow a low-fat diet, and now they realized that they were wrong, and for many reasons like this. And now they're saying we don't know what to do because the whole society is thinking we need to follow low-fat, and to get them to stop using low-fat milk and low-fat yogurt is going to be a big deal. But luckily out here in Fairfield, I see everyone having whole milk and ghee. So we use mucuna. Mucuna is the herb they use in Ayurveda for Parkinson's, and it helps you make your own dopamine. We have it in all different forms, drops, creams, tablets. The diet, we clean the nerve tissue. Guducci can clean the nerve tissue, but there's another one called Moringa oleifera. You don't have to take notes on all this. I'm just showcasing our work to show you how in-depth we're treating all these things and why we're having all these miracle cures. You heal the nerve tissue. Now these two herbs, sensitive plant and laksha, they took Dr. Mishra many years for him to get them to me. Sensitive plant heals the nerve tissue. We use it in all our MS cases, and laksha heals the myelin sheath. That's the covering to the nerve. And you can nourish the nerve tissue with ghee, but the ancient doctors of India said if you put those herbs that are good for the brain, like Goda Kola, Bacopa monieri, like Jodhishmati wakes up, like brightens up the brain. If you put them in ghee, the ghee will deliver them into the brain. So Dr. Mishra has this ghee, I use this myself every day, called Maha Saraswati ghee. Saraswati is the goddess of wisdom. So he cooked the herbs in ghee, and by taking this, I use this as my ghee. It helps to prevent, the brain from, like dementia, and Alzheimer's. So we can go to the next one. It's very good for memory. So dementia and Alzheimer's. Again, you want to nourish the brain with good fats. The brain is made of cholesterol. Always remember that. And again, you can detox the nerve tissue. What you're seeing with dementia and Alzheimer's, all that is, it's lots of toxins have made their way to the brain. Avoid the flu shots. They still contain mercury, at doses that are way too high. And scientists at the University of Calgary did a great study. It's on YouTube. They actually videotaped the nerve cell with the dendrites. The dendrites are the extension of the nerves. After a flu shot, you can see the dendrites dying. And from that one study, they extrapolated it would take about 10 flu shots to give you Alzheimer's. Now, the patients coming in are reading the research, and one of them said to me, oh, no, that's an old study. The latest studies are saying 3. See, Alzheimer's is to the adults what autism is to the poor babies. They're getting the same shots. They're both damaging the brain, see. Now, also avoid cholesterol medicine. I can't tell you how many patients coming in, they're on these, they're called statin drugs. And what they do, see, your body needs so much cholesterol every day. Cholesterol is a very important thing. It's not that it's a bad thing. In our minds, we think of it as a bad thing because doctors have trained us that way. They incorrectly believe that cholesterol clogs the arteries. But when they examine the arteries of people who've died of heart attacks, they find these trans fats. You know those as partially hydrogenated oils. They're like plastic. When you pump hydrogen into an oil, it turns into plastic. So they put that on the food. Once we had this idea we wanted low-fat everything, everybody started eating margarine and those types of things. And they put it on food to give it a shelf life. But when we eat that, we can't get that out of our channels. It just stays there and clogs and gives heart attacks. That's when the heart attacks started to skyrocket, back in the 50s when doctors said eat more margarine, see? So we can't eat enough cholesterol in one day that our body needs. So the liver has to make it so the brain doesn't suffer. And the statin drugs prevent the brain and the liver from making cholesterol, and then it causes brain cell death. So you can apply oil to your head, keep it cool and nourished. Meditation also helps plasticity to the brain and balances the brain waves. Okay. Cholesterol, again, is important. It's the raw material for all the steroid hormones, the adrenal hormones and the sex hormones, see, and vitamin D, see. So if you don't eat cholesterol, you can literally shrivel up and age more rapidly. So again, oxidized cholesterol is the real problem, not the kind of cholesterol in ghee or whole milk. Now, here's what happens with heart attacks. The receptors in the endothelial cells, they're the cells that are on the inside of the arteries. They pick up, let's say you just ate some, I don't know, something from Nabisco or Pillsbury or Jiffy peanut butter, something with those hydrogenated oils, saltine crackers, let's say. So the endothelial cells pick up the oxidized cholesterol, and it looks like bacteria to your immune system. So these macrophages move in to try to clean up what looks like bacteria to them, and it creates inflammation inside the arterial wall. Then this creates a negative charge on the inside of the arterial wall, and this negative charge attracts calcium from the blood until it calcifies the whole artery. See? So oxidized cholesterol also increases synthesis of a blood clotting agent called thromboxane in the platelets. So now you're getting like hardening of the arteries, they call it. Okay, next slide. That kind of shows you what it looks like. See, once you get those bad fats lining the arteries, then the calcium deposits there. Okay, next one. So what we do, keep the liver clean, keep the bile thin, the triphala, keep using your fats, don't let them accumulate in the channels. And we could clean the fat tissue using Indian sarsaparilla root, fenugreek, and neem. You want to eat the good fats, olive oil, ghee, avocados, nuts, seeds, whole milk. Keep the inflammation low. We have something called Prakrit, which scrubs the channels and brings intelligence back to the channels. But the neat thing is, we can break up these calcium deposits with an herb. It's called Passion Bade. It grows on the hard, rocky soil in the Himalayan mountains, and it breaks down the rocks. And there's a lentil called Kulthi lentils. They also grow on the hard, rocky soil in the Himalayas. And they have that intelligence to break up rocks. They themselves are hard as rocks, so you have to pulverize them into a powder before you eat them. And we have magnesium. If you put a calcium tablet in a cup of water, it just stays there. But if you put magnesium in there, it will dissolve. So with these different things, we can break up the hardening of the arteries. You could feel that in a person's pulse. They feel hard, and then over time, they soften up. Okay. Oh, we're done. So, I don't know what time it is. Is it late? Oh, okay. Does anybody have any questions before I tell you our big secret? Yeah. Spirulina? Oh, okay. And what were you wondering? How? See, it's one of those things that I don't know enough about, because when you study Ayurveda, you have to find out what happens when it comes into the body. Like some herbs, like ashwagandha, it's heating, so we don't recommend too much ashwagandha orally. We have it transdermally. So I'm not sure if that's cooling. Do you know that one? Dr. Mishra never commented on spirulina. Has he, James? Is it heating? It's what? Too much? Oh. The nadis, it's too much prana traveling and the nadis can't receive it. So it might be like too much of a good thing. You know, milk thistle's like that. Everybody uses milk thistle for their liver, but it's too strong. For the modern day liver is holding on to so many acid toxins, it can't handle that kind of detox anymore. Which are tamasic? Oh, onions and garlic grow on the ground. Mm-hmm. Oh, yeah. Leeks? I know he doesn't eat them. They do? How do you feel after you eat them? Not too hot inside? And you're probably cooking them anyway, which cools the heat down. It's probably okay. Did Dr. Mishra ever talk about eating leeks? I don't know. Yeah. It's probably okay.
Is it okay to drink alkalizing water?
You mean,
Like water that you make, you put water through a machine and it separates?
oh, okay. So she has a question. Is it okay to drink electrolyte enhanced water? We could call it that, where you're taking the water and putting electrolytes in it? No. Goes through a machine, like Kangen water? That, okay. So, see, you know about the pranic energy in nature? That's what gives intelligence to our cells. And that energy comes from the sun and the moon hitting the food as it grows out in the fields, the water as it's flowing down the mountain stream. So that pranic energy gets imparted into the water. So if you try to do something to the water, let's say you put chlorine in it, it'll kill the prana. So even though you filter it, you can't bring the prana back to life. But if you try to do things and add things to the water, like smart water or vitamin water, or putting some minerals in, that's not a good idea either. You want the water as it occurs in nature.
Could you comment on two things? One of them would be metals in the system, and then the other one is anything that you have to say about when someone's told their lymph system is maybe clogged?
Okay, so she wants to know about metals. What do we do for metals? A lot of people we see have an accumulation from the mercury amalgams and and all that. So Dr. Mishra made a formula called Rasa Sodica. It's based on cilantro. We have it in a cream form to put down the spine and a drop form to drink. And he also has a new tea called Garvisha tea, and that has coriander, because the coriander seed turns into cilantro, and it has guduchi and other things in it. So we do that. We do chelate, but we don't recommend the chelating agents that they're using out there, like EDTA. These themselves are toxic. So it might get rid of the mercury, but it'll have a side effect. So what we're doing doesn't have a side effect. That's what we're doing with all the autistic kids. They're getting their levels of heavy metals tested. It's not like we're saying we think they have heavy, they're coming in with all the blood work. Again, that's why I don't know why there's any controversy as to what's causing all the autism. Oh, I'm sorry, the lymphatic system. Well, that's a system of channels through which toxins flow. So the blood system has muscles on the walls of the arteries and veins to pump the blood through. The lymphatic system is like the waste disposal system. It doesn't have any muscles. So one way to stimulate it is by you exercising, you moving. That's why when you're in the hospital, they want you up right away. They don't want you to lay there. But everything we're doing with teas and detoxing is cleaning the lymphatic system. It's just the ancient doctors didn't have that name. They just talked about the physical channels in the body, they said, that carry things. These channels could shrink up, they could get clogged up, or they could get inflamed. So the very first thing we do with the new patients, we have them avoid those three groups of foods. Foods that shrink the channels would be the nightshade vegetables, you know those, eggplant, bell peppers, tomatoes, white potatoes. The foods that clog the channels, soy is a big one. Tofu, soy milk, edamame, big channel clogger. It clogs the channels so much that when we see that in a person's pulse, it's extreme, and we call it a tofu pulse. So that's what Dr. Mishra calls it. So soy would be like a big one. But also bananas can clog the channels, and red meats. What's that? Peanut butter. Oh yeah. So see how hard it is to swallow peanut butter, let alone when it gets in the channels. Now, I have a lot of patients right now whose lymphatic systems are extremely clogged, and we have them avoid those groups of foods, but we also have things for circulation. One of them is called Sancharan cream, and it opens the channels by heating them, but sometimes you have to use cooling. And he made a new one this past spring called ALA, alpha lipoic acid cream, and it's amazing. It can open up the channels and cool down at the same time. To me, that's groundbreaking. We've never had anything like that because you usually have to heat. You know, the ancient doctor said, if you want to open a channel, use ginger and hot peppers and, all kinds of pepper. But nowadays, we're seeing a lot of amavisha, this hot AMA in the channels, and we're seeing what's called Garviscia, these chemicals, antibiotics and pharmaceuticals. So they're upsetting all the lymphatic system and all the channels, but it's hot. So what do you do now? So that's what, if you listen to my classes, you'll hear me talk about. It took Dr. Mishra about 4 years to figure out, what do we do now? The ancient doctors didn't talk about this. They talked about AMA, you burn it out with ginger and pepper, you drink hot teas, and you're good to go. But what do we do with people that have all these pharmaceuticals in their system? And so everything kind of that we're talking about will help the lymphatic system.
Like stevia or substitutes for sugars?
Some of them are a little heavy. They have a little bit of too much of that soma quality because they're from the cactus plant. You know, just see how you feel. You could use like evaporated cane juice, you know, that sugar, like a natural sweetener. You know not to use the artificial sweeteners, which, by the way, burn the myelin sheath. They're a little heavy too. See how you feel after eating. If it's just occasional, it's probably okay. Just like coconut oil, a lot of people are eating that. If you can digest it, be careful, but not everybody can. Mm-hmm.
I know it's mentioned as we went through this great body of material. Some how to address pesticides and herbicides.
Oh yeah. Well, we have so many things. The opposite's true. We have like too many things. She's wondering how we handle pesticides. It's a pretty polluted world we live in. So we have this tea called Garviscia tea. Pesticides come under the classification of Garviscia. See, AMA and AMAVISCIA are made in the body, but Garviscia is the chemical from out there. Pesticides, heavy metals, pharmaceuticals, vitamins. These are all the Garviscia. So we have like 1,000,001 ways. Gaducci and there's Garviscia tea. All those things I was talking about before, you know, Indian sarsaparilla, getting rid of the toxins and the fat tissue. And, mm-hmm. She's wondering how many people can I treat over the phone. Most of the patients that I've treated over the phone, I nailed it. I got it right. And some of those were able to come in the office, and when I checked them, I was right on. But there were some that I needed to see in person. But I figure at least let me get them started on some detox, the diet, and there are some general things. If a person calls me and they have ulcerative colitis, I know I have to use boswellia, regrow the friendly bacteria. There are just certain things we have to do for each thing that we see. But then there's always some specific thing that it's always best if you could see the person in the office.
Please talk somewhat about sunscreens.
Mm-hmm. She was saying, talk a little bit about sunscreens. Well, the skin, when the sun hits the skin, many things happen. We haven't discovered all the things yet, but we do know that the skin makes vitamin D underneath. And the latest research I heard was that something else is made that prevents heart attacks. But Dr. Mishra is certain that there's other things that happen when the sun hits the skin. So it's an important thing that the sun hits our skin for maybe 15, 20 minutes a day. Now, if you're going to be out in the blazing sun for hours and you're going to get burnt, you're going to have to use sunscreen. Try to get the least toxic one you can. Dr. Mishra tried to make one. The closest thing you could get to, it's called Surya Shanti cream. Surya means the sun. Shanti is like pacifying. It seems like it helps sunburn, but he wasn't able to make a sunscreen because it's blocking, you know. So just use it sparingly if you have to. But do know, some of the patients we see now, because of the dermatologist, they're getting very hyper about being out in the sun. The dermatologists make them feel like if they go in the sun, they're going to get skin cancer. So they're never getting out in the sun, and the only time they do is when they have sunscreen on. That's not a good idea. Just be, you know, make common sense with it. Mm-hmm. What was that? Xylitol? Is it directly, or did they synthetically make that? Because it seems like it gives a lot of people diarrhea. That's why I'm asking.
Most of it is made in a reactive kind of vessels. It's not something you can do in the kitchen.
Yeah.
It's in a process plant.
It's a plant that doesn't affect the gut.
Yeah, it seems to give a lot of diarrhea and cramping and gas. Did you ever eat it? And,
Just the thing.
yeah, it might, but I don't think I'd have too much of it. Yeah. Uh-huh. Uh-huh. Get in the sun. She's wondering if someone's been diagnosed with basal cell carcinoma or melanoma. They're very paranoid about being out in the sun. Then get in the early morning sun before it's real high for 10 or 15 minutes. You're not going to burn anything. If you had some carcinoma on your face, put a hat on so maybe the sun doesn't hit your face. But you have to expose your skin somewhere to the sun, or else too many other negative things are going to happen. Mm-hmm.
Two questions. One, can you purify water, get some prana in the water by just putting glass bottles out on your porch?
Yeah, that's right. He wants to know if you can get more prana in the water by putting the glass bottles out in the sun and in the moonlight too. You get both vibrations. You can do that.
The other question is, what would you recommend for prostate health as you're aging?
Anything you can do to control inflammation, the friendly bacteria, prevents infection in there. Mm-hmm. All these things, yeah. Dr. Mishra has some formulas too. Zinc is good.
Is this lecture going to be available? This was a great lecture.
I don't know.
I'll talk about it.
We'll figure that out. Oh yeah, wait. Dr. Mishra has a video of this lecture on his website. You can buy it. Yeah.
What do you recommend for living in a very cold climate? For sun? Yeah, for sun.
Well, she's saying we don't get exposed to the sun in the winter. So when you can, like now, get out in the sun a little bit every day to build up your stores of vitamin D, and then it'll dip low. There's a lot of research going on right now, mainly at Harvard, and the researchers there think that we have this all wrong about vitamin D, that the levels should be extremely low. See, everyone who gets tested, they're being told it's too low. So they're supplementing them with these high doses of vitamin D, 5,000 units, 10,000. And the researchers are saying, no, it's normal to have low. So see, like when the sun hits the skin, you're going to make a little. And I always think it's not good to go against nature like that and to suddenly flood the body with all this vitamin D. That's not how it would have occurred in nature. So I think in the future we'll see some research coming out that they might not give those supplements out anymore. It's not the way to go.
So you can store up enough in the summer.
It's going to dip low, but I think it's better than, well, we have a vitamin D transdermal cream you can use through the winter. That's what we do. Just rub it on your skin. Yeah.
There's a lot of diagnosis of shingles and infections.
Mm-hmm.
And they recommend people recommend vaccines. So that
Mm-hmm. She's wondering how to prevent shingles because the doctors are recommending the shingles vaccine. See, that virus, the chickenpox virus, once you get that, it's always latent in the cells, and it needs some heat to bring it out. So lots of times it's the PITTA type patient, people with the red hair or the blonde hair, the PITTA types. Like you look like a PITTA type. So you have to learn then how to keep the heat in your system low so that it doesn't activate that virus. My sister has red hair and she's fiery and she was under a lot of stress and she got shingles, but if she had learned how to keep the stress low and stay alkaline, I don't think she would have gotten a bad case of it. But we're seeing little children now too with shingles as you destroy the friendly bacteria, and yeah. But I always use those shots as a last resort because they're so dangerous.
what else do you recommend? What about cultured vegetables and cultured vegetable wires? There seems to be a big trend in that direction in these times for repopulating friendly bacteria growth.
Dr. Mishra doesn't like, she's wondering about cultured vegetables and cultured water. The ancient doctors said if you take yogurt with the friendly bacteria, it shouldn't taste sour. That's what they said. So are the cultured vegetables sour when you eat them?
Well, if you make them yourself, like I have a friend who
Mhm.
And so I'm just wondering.
Yeah, Dr. Mishra, he's commented on kefir, that he really hates.
Oh, really?
And then that other one, that drink, what is it, kombucha? Oh, he hates that one. Didn't you read his website? He had an article on that kombucha where people were being rushed to the emergency room, and it's too acid, you know. Yeah. Did you read that one? Kombucha, yeah. Yeah, so I would stick with maybe, you know, cooking the vegetables, put ghee on them. I don't know about culturing all the vegetables. That must take time too, doesn't it? Yeah. Because I don't think the ancient doctor said we had to culture the vegetables. Dr. Mishra trained us directly from the ancient text. He was transcribing the Sanskrit, so we got to see. And I never once remember them saying to culture them. Yeah.
So you're saying mostly fresh coconut water that might be cultured, or you mentioned butter,
Yeah, because it's nice and alkaline. So all these mediums are alkaline. Mm-hmm.
buttermilk and yogurt instead also.
As long as the yogurt's not real sour.
Yeah, if you make it like the night before that morning.
Mm-hmm.
So it's
Yep.
If you alter the cream, and then you beat it and get butter out of it, that buttermilk is absolutely delicious and not sour.
Right, that's right. She's saying if you take heavy cream and culture it, this is how they make ghee in India. This is the best way to make it. See, here we just melt the butter, skim off the dairy solids. But if you put an active yogurt starter and heavy cream, now you have yogurt cream, and then you churn that into butter. Then you get buttermilk as a side kind of effect. That buttermilk is the type of buttermilk that the ancient doctors were talking about. And that's different than if you make paneer. A lot of people ask me, well, what, should I drink the water from paneer? But see the difference, you're boiling that, you're killing the friendly bacteria when you make paneer. But this way, that's exactly right. So that buttermilk you would sip in between bites of food at lunchtime. Because it's still a little channel clogging, we don't recommend it at night.
Making paneer then, with yogurt as opposed to lemons?
You could do that, anything, either way. But I'm saying that you wouldn't drink the water from the paneer, because there's no friendly bacteria in it now. Mm-hmm.
People with high cholesterol, it's been recommended to dilute their milk. Diluting whole milk, like you should recommend in terms of drinking milk. Is it better to switch to low fat, or is it better to have whole milk?
Right. She's saying people in this community have been diagnosed with high cholesterol, and they've been told to dilute the milk with some water. Is that better than drinking low-fat milk? Yeah, that would be better, because if you process the milk and now it's low-fat, you're taking the intelligence out of the milk. But if you take the fully intelligent milk and just dilute it, that would be better. But I would take that one step farther, and I would try to thin out their bile and get rid of the reason why the cholesterol is going up. Because you should be able to have some cholesterol in your blood, you know. And also this ghee that she was describing, if it's made from the yogurt, the friendly bacteria in the yogurt breaks down the fat particles into those omega-3s. So that would be better for someone with high cholesterol to eat that type of ghee. So there you go, Billy. You could set up a whole business making this ghee, because he knows how to make it. And I don't see it here. Do they sell that in Fairfield?
No, not the culture ghee.
See, if I lived here, I would do that. You
Well,
could
we've
do,
done that, and
you can buy it. Well, Dr. Mishra makes it too. He calls it Mum's ghee. Yeah, we carry it in our office.
If you want to make your own ghee, buy cultured butter.
Cultured butter? Would that be the same? Mm-hmm.
yeah, the old style cultured butter, not the stuff where they throw in ascorbic acid or citric acid, but the actual culture with a culture into the butter.
Does Radiance Dairy have a cultured butter? No.
No, you have to make it.
It's not hard to make. You should make your own. Then you know you're getting... Yeah, but you have to use a good yogurt starter. Dr. Mishra and I talked about this for a long time too. And the one from Nature and the same company whose probiotics we use, they have the best yogurt starter.
Let's take one more question.
And then we better get moving.
And
Oh, the secret. Oh.
keep her on the routine.
Okay, wait. Did someone have their hand raised and I kept missing it over and over? Okay.
Cultured butter, because I know that the yogurt was a problem finding live culture in yogurt that's on the shelf.
Oh, they're all
What
bad.
about the cultured butter then?
That's what I'm thinking too. I think the cultured butter, she's saying the cultured The yogurt on the supermarket shelves probably doesn't have good friendly bacteria, and you're right, it doesn't. So it's better to make your own yogurt, and that's the same with the cultured butter. Probably it's been sitting there and it's losing, each day it's sitting there, it's losing more friendly bacteria. That's why we really recommend making your own, and then you have quality control. Vitamin B12? Dr. Mishra makes a transdermal cream of that. Yeah. It's hard to absorb it, orally. But most of our patients who've been deficient did real well with the transdermal. Okay. What?
We want to keep her on the program. She's here to
to round and
round and rest.
Right. Oh, my bike's really.
A little bit off. We are so fortunate to have Dr. Teitelbaum here. She has the confidence of Vijay Mishra more than anyone else I know. And it's because she's a laser beam. She's kind of like the mongoose that goes after the cobra. How can it possibly take over? But it does. It takes over this huge thing. And so it's like she as a mongoose is after this idiocy about health, how to take care of it. Now, you don't have to remember everything on the way out. This is important that there's so much available, and we can get that information to you. Several things to just talk about real quickly. Again, Vijay is going to be having a course. He's offering anybody here who is interested in taking this e-pulse course, the electronic pulse course. In other words, it's going to be online. And it's going to begin this week, or next week I should say, on the 18th will be the inauguration of it. It'll be once a month, plus there'll be studying, there'll be a chat every month. The benefit here is that you're going to learn how to take your own pulse, how to take others' pulse, what is being registered when you do take the pulse. So you can find these things when, that Dr. Teitelbaum was talking about, like having calcium blocking in the arteries. It's all there in the pulse. He's going to teach you the fundamentals and the information about it, as well as the MARMA points, which we could talk about for hours. And I think the definition of MARMA is mystery. What is it? We don't know. But the master MARMA point we have up here is the one, the Adipata MARMA. Oh, yes, I can. We have the master MARMA point. I shouldn't be talking about that. This is something you can do much better than me. But these are things that Dr. Mishra wants to teach. He wants people in our community, in Fairfield, because we're so awake to some of this, the opportunity to know what he knows and where it comes from. So the brochure's out there. Again, there's a early bird discount that he's offering, extending to everyone here. So take advantage of that. Now, again, there is the manual, or the manual. There's the brochure that has the newsletters that he's produced over the past several years, plus a DVD in here. So everyone is welcome to one per family. Don't take one for someone else, just because we can get that to somebody later on. The other thing here is that there's two things. We have the lectures from Dr. Teitelbaum that she gave back in 2010, 2012, and they're really fundamentally sound and really makes this understandable. Everything that she covered tonight on the board up here is in these lectures. Simple way to get that is give us your email on the list in the back. I promise you it'll only be so we can send you the link to download these lectures, which we have on Dropbox. And the other thing is Dr. Teitelbaum does see patients. There's several here that have gone. We took a little cartload of people about 2 months ago. It was quite a road trip. But she does see people and patients in person in her practice there in New Jersey, right across from Philadelphia, at Teitelbaum, TEITELBAUM.com. There is her website. That's a way to contact her. There's another value which we could work with if you can't get to Philly or the area. She does phone consultations and treatments. The other thing is that most of the most of the medicaments that Vijay has produced, that Dr. Teitelbaum produces or recommends, we have different ones available. So you contact us if you want to be able to get them quicker. But Dr. Teitelbaum's office can also get them to you as well. So all is not lost just because you leave out the door and Dr. Teitelbaum will not be here after tonight. Contact us so we can get the information to you, the lectures, and so you can get more familiar with this. A lot of it is reducing down to some very simple and very powerful information that Vijay's brought, and Dr. Teitelbaum has done such an excellent job of making available.
How do we contact you?
On the ad, I'm Billy Hunter, and Dawn was running the projector tonight. Dawn and I are at the Fairfield Wellness Center over here behind Curves for Women. But you can contact us there. We have a website called Holistic Healing Fairfield, all one word, .com. And we're in the phone book under William and Dawn Hunter. We have a landline. One of the few that still exists. Again, thank you so much.
Should I tell them the secret?
The secret. Here it comes.
Okay, so I cleared this with Dr. Mishra, and I'm allowed to say it. Did you ever take an herb and your friend has great results from it, and you take it and you don't feel like anything happened? We've all had that. The reason is it's having a hard time getting in the cells. And the ancient doctors talked about they're called yoga vahis. That means when you make a formula, you put in the formula something to bring it in the cell, see? But there's this great yoga vahi, it's called silica. And the ancient doctors said if you take silica and you burn it 1,000 times, then it's a great yoga vahi for everything. So whatever remedy you're taking that's not working, you can take it at the same time and it'll deliver it in the cells. So Dr. Mishra has been involved for this whole spring making this, it's like an ash of silica. And he has a very little bit. That's why I didn't know if I could tell you about it. I don't know how much he has to go around, but he's got some now, about 12 grams of it. And he tried it out on a few people. One is someone who we've been trying to fix his blood pressure, and no matter what we've done, and he's a thin guy too, we couldn't get it to go down. And then he tried other remedies, and they didn't help either. So Dr. Mishra had him come over, and he took the blood pressure remedy that we use, it's called sarpaganda, along with the silica. And within minutes of taking it, his blood pressure went down. He also took someone who has kidney failure and is on dialysis, and he put him on it. And right away, he didn't need the dialysis. So I just called his office right before I got ready to leave here and to see if he has any that he could send me, and they're sending it to me 2-day air. So what we're going to do for someone who has something very serious, the ancient doctors felt that it could actually cure cancer. That's what they said. So he's making it for some cancer patients. But I have a waiting list right now of cancer patients, people with MS, and people who the herbs just weren't working, which there's not that many, to be honest with you. So, but I think that all of us could benefit from this. I just don't know how much he could make right now. But he's getting ready to go, and I think he might have a few hundred bottles, but that's like his latest project. To me, it's like one of the greatest things he's ever done. He's very excited about it, and so I'll keep you posted. Next time I lecture, I'll let you know some case histories of people that responded to it. Mm-hmm. Yeah?
In Italy, they have developed a way to burn the herbs. They call it spaghetti.
Uh-huh.
Have you heard of that?
No.
There are some companies that process their herbs in liquid form, and they take the same herbs and they burn them over and over
Yeah.
again, and they add it to the liquid.
Uh-huh.
They call it spaghetti. And there are some companies that do blend that into their herbs.
That's a good idea. That might be like the wave of the future. Dr. Mishra did send me a link for some video on YouTube where when you burn the silica, it forms what's called a nanoparticle. It's a very small particle, and it's able to absorb into the cell better. My son, who's a chemical engineering major at Princeton, I asked him about it, and he said that's exactly what you have to do. You have to burn something over and over for it to increase the absorption of it. That's what these basmas are about. So this formula will be called Abrak Basma. That's silica basma.
Is that only available through you and Dr. Weiser?
I don't know. Do you have any?
We don't have
Yeah,
any.
yeah, nobody has. I don't even have it yet. But I will have it Monday morning. See, so, yeah. What's that? Dr. Mishra told me they have some in India, and he looked at all the labs. Like, he just got some in. They burn it 300 times. But he said so far, he only found one lab that burned it 1,000 times. And he got that, so he has 12 grams of that. But he did get the one that's been burnt 300 times, so he has to finish that one. But he had some people chip in to buy him a kiln. So he's going to be burning it. But he also needs an electron microscope. So that, I don't know. We're just going to get that one. What's that?
She's here to rest.
I'm only here one more day and then I'm leaving. Yeah, so I'm just going to be around. We came for Guru Purnima, so I'll be in the dome if you want to say hi, but I won't be able to see patients this time.
Are you coming back?
Am I coming back? I don't know. Are we coming? It won't be for a while if we do. Right now, he told me he's not seeing any patients because he's working on this project. He's been bumping everybody to me that calls his office. Now, I think he will see some. There are some in here that might have seen him. He'll see a handful, mainly if they've already seen me and I can continue. He can't continue with anyone's case. This project has been consuming him for months. And so he's not seeing that many. But, you know, there's always a chance if he wanted to fly out there, he might just see you that one time. But I don't know if that's enough because you need to, you know, get checked up, you know, several times to see how you're doing. That's something he can do.